There you go. There's your notice. But again, thank you for joining us for the first, our first benefits fair. This is our third session of the benefits fair. And I am Kimberly Williams. For those of you who don't know me, I'm the Assistant Town Manager for the Town of Bridgewater. Joining me with co-hosting duties today is Jessica Rojas. She is our HR generalist. Each of the presenters that we have with us today are going to be making a short presentation, and then we will turn the session over for questions. With that, today I have with me Elizabeth Jenny and William Hickey of Harvard Pilgrim. Harvard Pilgrim are longtime vendors for the Town of Bridgewater. So with that, I will turn the hosting over to you, Liz and Bill.
Great.
Liz, take it away.
Hey, thanks, Bill. Hi, everybody. This is exciting. I hope more towns will follow suit and do meetings like Bridgewater's doing. This is great. So anyway, so the good news, I'm Liz, you already know that, but the good news is that there aren't any changes in your benefit plan going forward. So starting with the July 1st renewal, you'll have the same co-pays, and I'm just going to give a brief overview on the plan design. If you have questions and you are familiar with the chat box down at the bottom, I'm not sure if all of you are, but if you want to ask a question, feel free, and I'll kind of navigate over there to answer any questions. If you want to wait till the end, I'll certainly open it up for questions. And lastly, if you have a question you don't want to ask in a group setting, feel free to pass your information, your contact info on to either Jessica or Kim, and I'll be happy to reach out individually with any questions that you might have. So I'm just going to share my screen here and pull up. So hopefully everybody can see this. Everybody see this, the full screen slide here? Great. Can everybody see that?
Yes.
Okay, great. So as far as the plan design goes, I want to first remind you that your preventive visit, as you probably know or might remember, is covered in full. So anything related to your annual physical, you do not have a copay for that. Some providers continue to need to be reminded of this, so please feel free to do that. Sometimes they're on autopilot and they'll ask for your copay. So if you go for your physical, you copay any lab work that happens at your physical, your annual check. There are certain labs that are covered as part of the Affordable Care Act preventive healthcare services, things like overall screenings, total cholesterol, things like that. So those are covered as well. So just a reminder. In addition, mammograms, et cetera, all the things you see here are also part of that list of preventive services. So that's just kind of a reminder on that. This chart on this slide gives you a brief overview on your core benefits. So just a reminder what your copays are. You have a split level. It's a tiered plan, the benchmark plan. And your copay for primary care is $20. Any kind of specialist visit or hospital-based is your tier 2 copay, which would be $60. You do have a deductible in place for certain services. It's $300 and $900 per family. As you can see, acupuncture and chiropractic are both part of your benefit package. A certain number of visits each plan year for those. Your emergency room, you have a deductible, and then you have a $100 copayment. So just as a reminder, if you need services, try, if you can, to utilize the urgent care benefit, because you're going to pay a lot less if you go to an urgent care facility, whether it's a CVS Minute Clinic, your local urgent care, not to mention waiting in the emergency room. So you have the cost and you have the wait. So, and while I'm talking about urgent care, telemedicine is obviously something that's widely popular right now, but not everybody has taken advantage of that. We do have and offer telemedicine, and all copays, any kind of cost sharing related to telemed right now during this COVID crisis that we're in is covered. So you do not have to feel like you need to venture into your doctor's office. You know, could be difficult to get an appointment at this point, but if you obviously need to be seen, you need to be seen. And if telemedicine doesn't work for you, then you can certainly do that. But we are waiving cost sharing for all telemed services, not just services related to coronavirus, but any telemedicine visit. So keep that in mind going forward as far as your coverage and just trying to keep more money in your pocket. Hospital inpatient, of course, has different costs depending on which hospital you're admitted to. So if you are at a tier 1 or tier 2 hospital, you'll have a $500 copayment. That's for your inpatient admission. And if you're in a tier 3 hospital, your copayment is a bit higher at $1,500. I will go through and kind of walk you through. There's a slide coming up that will talk a little bit about network and how you can access that. There are also a few questions that I forwarded to Jessica that show you step how to access providers on this plan. Day surgery is subject to your deductible, and then you have a $250 copayment per visit. X-ray and lab, regardless of where they are, you have deductible, then covered in full. You have prescription drug coverage. The good news on the prescription program is that you do have a very rich package with the premium prescription plan. So you have copays that are in 3 tiers, 10, 30, or 5. So typically that means generic, some brand names that don't have generics and different alternatives, and then your higher cost brand name drugs are in tier 3. You can also use the mail, and you do save a bit on that. If you're utilizing the mail order, you get a 3-month supply for the cost of, for example, in tier 1, you would get that for $25. And as far as the, let's see, just moving that. As far as urgent care, we talked a little bit about that. You can utilize a CVS Minute Clinic if there is one near you. I know there are a couple on the South Shore, not sure in your area, but you can access that for a lower copay, as well as any other urgent care facility that you need. Again, saving you time and money for sure, as well as telemedicine. So we use Doctor on Demand. You download this app if you have a smartphone. It's easy to set up your profile. It would be a good idea to do that ahead of time if you're considering any kind of visit, virtual visit, because then you're sort of ready to go. You can even go on and sort of play around with it if you haven't used it before. You can see which doctors are on call at that time for your area. Obviously, it's not something that you can use for emergencies. You would still need to use your judgment and use the emergency room if you need to, for sure. But these types of situations can be handled during any sort of telemedicine visit. And you can also access behavioral health, either with Doctor on Demand or with Optum, who's our mental health partner. In addition to your core benefits, we have some fun stuff, some discounts. So as a reminder, you can submit for your fitness reimbursement. We reimburse you $150 every calendar year. So you are access that. There is no specific list of gyms like there used to be many years ago. So as long as your gym has both cardio and weights, you can submit for that. Online is the quickest way to get your money back. You can also download and print the fitness reimbursement form if you prefer to mail that, but it's a pretty easy process if you do it via our website.
Hey Liz, can I jump in for a sec?
Jump in, thanks Bill.
Mayflower actually increased their fitness reimbursement benefit to $300. So it's
even better.
There you go. It's even better.
That's great. Effective
this year.
Oh, great. Okay. Thank you for that. That's wonderful. So 300, terrific. In addition, you've got some eyewear discounts. You can use VisionWorks. There's a free eyewear program. If you get your eye exam done there, if you're not particularly attached to your ophthalmologist, you can get your eyes examined at VisionWorks and choose from their free eyewear collection. If you want to go to your eye doctor, that's fine too. And you can still get discounts at VisionWorks and any of these other places here, LensCrafter. Thinking Sears is probably gone, so we'll take them off the list. But anyway, many more discounts besides just these. If you go to Harvard Pilgrim's website, there's a much longer list of many other discounts, some things that you might even be using. So this kind of gives you a little bit of an overview on what you can do on Pilgrim's website, our member portal. If you just take a minute to establish a username and a password, you can do all of these things you see here. Check on your benefits and claims. Let's say you're getting a bill and you're pretty sure it's already been paid and you've got no more financial responsibility. You can see when that claim has been paid by Harvard Pilgrim. And all of that. You can order a new ID card. You can access your discount programs that I just briefly went over. And you can also look up certain conditions, kind of like D, on our website as well. So you can use it for as much as you need to or as little as you want to. And then these are just ways to reach out to Harvard Pilgrim. If you have a question on your specific benefits, you can reach out to this number here. There's a prompt. If you are a member, it will prompt you to select a number. And then if you're a non-member too, you can ask questions prior to joining. You can also do it via the web. You can send a secure message as long as you have that username and password selected. You can go onto Harvard Pilgrim's site and email member services. And then there's also a chat feature that you can, in the lower right-hand corner of your screen, you'll see a chat feature that you can use as far as asking a question. And that's kind of all I have for this. Let's see, I'm just gonna look to see, I'm not sure if there's questions. Looks like there's a question here. Let's see. Yeah, I don't see any questions. Anybody have a question they wanna ask right now? Questions on what I just went over? Any
So
questions?
I'm just looking through.
See if
So I have a question, Liz.
Sure.
Where can I find out if my prescription is covered and what would the copayment kind of be?
Great. So if you go to the Harvard Pilgrim site, and I think I have that up here so I can share that with you. If you go to, so this is Harvard Pilgrim's home site. So this is also where you can access and look up providers. Yeah, this was one of the questions I kind of forwarded, but you can access a number of different things on this. And if you scroll down here, you can click on either find a provider, check your drug coverage. So when you come here, you're going to select the premium 3-tier plan, which is what you have. So the Town of Bridgewater has this program. So you would click on that, and there's a number of ways that you can search for it. So you can find out what tier they're in, covered. If you scroll down here, you can look up the prescription drug list. You can look up the tiers. And then there's a place you can call for questions as well. In addition, if anybody has a question about a provider, you can access the provider list here as well. So I'm not sure if anybody has questions about that. I can certainly go through that. Did that answer your question?
It did. We did have another question that came in from the chat, actually from Michelle. And I'll unmute your mic, Michelle, and you can ask the question.
I don't think I have a speaker.
We can hear you.
I can hear you, yep.
I was just asking about the tiers of the hospitals.
Right, so,
No,
okay.
just which hospitals and which tier.
Sure, which hospital do you usually use?
It depends.
Depends, okay.
Some in Boston and some on the South Shore.
Great, so if you go, again, if you go to Harvard Pilgrim's site, can you see this page, the home page?
Mm-hmm. Yes.
Okay, and you would click on find a provider at the upper, right at the top there. And then you can either select a plan right here without logging in. So let's say you didn't have an account set up. You can just select a plan as a guest. And you would go down right here. You are offered the HMO plan, and then you would scroll under plan category and choose tiered. And then here's your choice net. So you would click on plan, depending on if you're looking for, you know, a particular hospital, but you can type in, so let's type in Good Samaritan. So it'll tell you, click on search providers. There's also a list of these. Bill, I'm not sure if you forwarded the e-kit to Kim or Jessica, but it's in that e-kit as well.
And if it's not in that e-kit, we'll make sure we get them over there.
Right. So Jessica, one of you could forward the e-kit out, which includes all of this. So as you can see here, Good Samaritan falls into, where are we here? General acute care. Right down here, it's tier 2. So you can access it that way. And then in addition to that, this is what hopefully you can you see this? Can you see a list of hospitals here?
I see the Good Sam in Foxborough, and then I see a Good Sam below. One says tier 1, one says tier 2.
Okay, so maybe, let me just make sure. I'm going to try to share this again. Do you see a list now?
Yes.
Okay, so this is what this list here is, which is in the e-kit that can certainly be forwarded to anybody who wants it, has a list as of 1/1/20 where these hospitals fall. So as you can see, they're all listed here. So you can look up Boston hospitals. Typically all the partners hospitals fall into tier 3. So if you're looking at Brigham or MGH, anything of that nature, you can see here that those are tier 3. Good Samaritan, Brockton Hospital's tier 1, and they're all listed here. Hopefully that will be helpful to you, and it continues on into other states as well. Does that answer your question?
Yes, thank you.
You're welcome.
Great. So I don't see any additional questions in the chat. Are there any additional questions before I close our session? If you would, you can check the green checkbox. Seeing none, I would really like to thank you, Liz and Bill, for joining us today. This has been valuable information for our employees. I'd like to just close by sharing my screen and giving you some information from Human Resources. Hopefully this works. Hopefully you can see my screen. To contact us about your open enrollment, for if you're interested in Harvard Pilgrim, please, you can give us, email us at hr@bridgewaterma.org or call us at our number 697-0791 or on our temporary cell phone number 774-380-0073. We've sent all of this information out to employees and retirees in the recent newsletter that we mailed to you, and try to give you some information. If you wanted to do an open enrollment and do your forms, please reach out to HR. But if you have specific questions about Harvard Pilgrim or other plans, please go to the plans directly. We'd like to remind our employees that open enrollment begins today and ends on Friday, May 15th. Open enrollment is the only time of year that you can make changes to your coverage unless you experience a qualifying event. And for us, no enrollment forms will be accepted after May 15th. So we want you to keep that information in mind. And if anything that we can do in Human Resources to be of service, please don't hesitate to reach out to us. Again, thank you all for joining me today. This webinar will be placed on our website probably tomorrow. And I believe that's all we have. And I'd like to thank you again. And this concludes this session of our virtual benefits fair.
Great. And feel free to pass on anybody's information if somebody would like someone to reach out to them.
Thank you, everyone. Have a
Great.
wonderful day.
Thank you.
Thank you.